My Care My Way was developed by local people and local GPs. It was about trying to recognise the best care we could provide is going to be influenced by current people saying this works for me and this doesn't. It's trying to help connect people to all charities and voluntary organisations that are there to support people. And its name has come through actually local service users saying this is what it means to me.
It's a very simple concept. It's about giving skills and knowledge and confidence to the patient to actually lead a better, healthier lifestyle.
We have an initial assessment, so that can be in the surgery or it can be via the phone. What I usually do is book a longer appointment with the GP and other health professionals and local authority like social services. We're looking at all of the factors. The GP will see the patients first and do the most of the care planning, and then the patient will see me or a case manager to continue the self-care planning and looking at interests, hobbies, things that they might need in their homes to maintain their independence. So it's much more of a coordinated care where everybody is involved and nobody falls through the cracks. Everybody's in one room, everybody's aware of the risk factors for these patients. If there is a crisis point, all of those agencies, they know exactly what to do and when to do it.
What I love about it is I have a designated nurse. If I've got some little thing, I can contact her. I'm not wasting a valuable appointment from patients who really need the help.
It's got such a huge focus on integration. So previously, I think there's been a problem in social care where everybody has sometimes fell into the trap of working in isolation. I think the My Care My Way service aims to get rid of that barrier and really join all the professionals up so we can all share our skills.
In My Care My Way, we believe each need is unique to the patient. A patient of mine, he's in his 70s. The problem was isolation and mobility issues, and some of parts of his places needed to be adapted. So in conjunction with the partners who we work with, they matched him with the right befriender.
Yeah, I think there have been a lot of benefits from the My Care My Way service for patients. I guess the one that stands out to me is that patients are actively involved and encouraged to participate in thinking about planning their care.
It's tailored to the patient. It's not very strict, or there's not rules or regulations on how we provide, and that's how we can provide a better service for people who are more vulnerable.
We had a patient who English wasn't their first language, so this service enabled us to get the family in for a longer appointment so that we had an interpreter, and the barriers to them taking their medications appropriately were able to be explored and overcome, so that at the end the patient understood their medications a lot more, so was willing to take them.
The most beneficial part of the service is to be able to talk to the professionals without any guilt that you're using up their time. And therefore you don't get depressed, and you know you're looked after, and you know that nothing is too small for the carers.
After knowing a patient for 20 years, maybe having the opportunity to meet with them for an extended consultation gives you an opportunity to really understand what makes somebody tick and what their priorities are, and to discover things that you might never have known.
So I think nationally the NHS is realising that we need to invest and support people sooner before their healthcare deteriorates. In that we can make a difference, that rather than investing all our resources into hospital care, if we put more investment into self-care, into local organisations that support residents living at home, and into primary care, we can help people maintain their health, and then there is a lesser need for people to go into hospital unless they really have acute healthcare needs.
One example I've got is I had a lady who had quite advanced dementia. So I was struggling in regards to thinking about if medication could help. So what we did is one day we arranged a joint meeting together at the integrated care centre where myself, the GP, the client and her daughter came along, and we were all able to sit down together in one room and come up with solutions. And that allowed me, for example, to give my input in regards to changing the client's medication and what's on offer from a medical perspective. And that then helps me when I go back to my management, in terms of they will often ask me lots of questions in regards to what can the doctor do. So it allows as well a reduction in time to get results for individuals.
So the plan for the My Care My Way for the coming year particularly with regard to involvement of all practices, is to make sure that we can roll out provision of the service to all practices rather than just the 50% that are currently participating. So we're trying to build on the success that we've had so far and get all the remaining 50% of practices actively involved.
They have access to the pharmacist who go through a medication review. They have access to social services if they do need any social input. They have access to their GP, more than a 10-minute slot in a GP practice. We're able to give them all these services for them to consider to keep them fit, well and healthy at home.
I'm excited to be part of it. I supported people over 65 for a number of years now. These opportunities to look at the person as an individual and work in collaborations with GPs and other health professionals to understand the person fully, their situation, I think is necessary to provide a better care and to plan for the future.
I would more than recommend My Care My Way. You feel inside that you're 16, but you forget that outside you're 77, and you just know there's someone there.